Greetings, students. Today what I want to do is talk to you a little bit about Chapter 17. And when we look at Chapter 17, what we're doing is we're discussing the adult nutrition and the different aspects and areas in which most chronic diseases are. So I want to just kind of head in. We're going to capture probably between slide 1 and slide 23 of the instructor slides, which I've already posted. But now I just want to kind of give you an overview. So for those of you that have not already looked at this, I know that we talked about this one right here in class, but I pulled up a chart and I was telling you about the #1 causes of death in America and looking at the different age groups. So that's what we're going to do here, and we're going to spend some time. This lecturette is really going to be designed around obesity. But I did want to point some of these out because obesity, although it's not on here, has a lot to do with a lot of these deaths when we start to look at people greater than 45 years old. So with that being said, let's go ahead and move down. This first thing is just a little bit more that we kind of already know, but I do want you to be very familiar with how to talk about obesity and, you know, what is obesity and what does it mean and how is it defined and how is it caused. So these are going to be some of the things that I want you to mull over during this time and think about how you would say some of those things if someone was to ask you about this. But definitely most of you know as far as obesity that it's going up or at least staying where we're at. We're not going down usually. We're usually going up or staying where we are as far as looking at rates. But almost right now, 40% of the US adults are obese. So the difference, remember, between being overweight and obese, I want you to know that. I want you to know the BMI numbers that incurs. And then I want you to think about, if we're just talking about overweight, that is pretty much saying here on this slide that 1/3 of the population are overweight. That's 1 in 3 people being overweight. And then we have almost 40% of US adults that are actually obese. So when we look at this, this is a big problem, and this is going to be a major area in which you're going to be seeing clients and trying to help them navigate through this. So understanding the numbers and then understanding the etiology of obesity. And, you know, we've always said that obesity is kind of defined as, or when we look at calorie levels, it's calories in equals calories out. But is it really? So that's kind of what I want you to think about here, is that yes, principally, that is the idea, that your calorie level, that is your set point for your body. When you take that in, that's what your body needs, and then what you expend out. However, are there going to be issues? Are there going to be things that might weigh on that so that calories in might not always equal calories out? But for the purposes of learning, first of all, let's kind of look at that and understand that when we take something in, if we have too much of it, it's going to get stored, and it's going to get stored as fat. So that's one of the reasons why. But then there's other conditions that might also be there that could cause someone from a hormone perspective to have an imbalance in their hormones, just then makes it so that that calories in, calories out doesn't work as well. And we're going to get into that. We'll get into it specifically with obesity, metabolic diseases, things like that. So you'll see it's not just calories in equals calories out. But if we don't have any other underlying health conditions, then it should kind of just be calories in and calories out. But I also want you to take a look in the textbook, and I want you to look at some of these things. I want you to look at how our gut and everything that goes in with our gut, and this also talks about the appetite regulation, and it talks about how GLP-1 and GIP are so important. So if you don't remember some of those things, you may want to go back to your elementary nutrition where you were learning a little bit more about metabolism and about these things. Or you might be, if you're taking Dr. Puya's class, you might actually have had this topic recently. But one of the things that we talk about is these hormones and how hormones can actually affect the regulation of certain things. So just keep in mind, at least when we look at this, that our gut is extremely important. We want to use it, we don't want to lose it, and we want to make sure that it's functioning properly. And these are some of the things that they can do. So big picture here, when I'm trying to explain obesity to people, that it's very important that they understand that when we look at our gut and our body, that there could be things going in our body that may or may not be helping with regulation of calorie uptake, okay? So looking at some of these, so when you're looking at the board here, changes and difference that may affect regulation. So our metabolism can affect it. Our adiposity, so it's people that actually have more fat cells. There's something that goes on when we look at lipogenesis that's very different. you'll see in a different video that we talk a little bit about that. Also, Dr. DeFranzio talks about that. He's a leading endocrinologist that talks a little bit about the core defects that we have with diabetes, and that's definitely one of them. But even just anybody that's undergone a larger amount of weight gain, which we're looking at usually like 20 to 40 pounds of weight gain, can have the same thing occurring. And so it becomes problematic. So metabolism itself, how our fat cells are reacting, the body and homeostasis. And we've talked about how the set point of our body, if we're changing it, how our body wants to just go back into conservation mode, and how we've looked at some of the studies with people that have undergone like major diet restrictions, like wrestlers and some of these athletes and football players, and then how they gain weight later. So, you know, looking at the body's ability to want to maintain homeostasis, and if we keep exposing ourselves to these fad type of diets, does that actually change that? So that's kind of what that's talking about. Energy balance, meaning again, energy in versus energy out, and then central appetite and this whole brain, and how does your brain work? Is there a reward system? We've talked a little bit about, you know, what our flavors like in our mouth and our tongue and how we feel that, and then what comes up to our head and how does that feel. Same thing after we challenge ourselves with a high carbohydrate meal. How do we feel after we've had that, those feelings? So that reward, the signaling that goes on. So there's a lot going on here when we look at the role of our gut and how it actually plays into all that. So take a little bit more time to look at that. I also want you to take a little bit of time and look at these areas here when we start to look at obesity and how some of these things come about. But I'm going to let you guys read a little bit more of that, because I want to get into this. Be familiar with the term obesogenic environment. So what does that mean when someone lives in an obesogenic diet, environment? What is that like? So just thinking about this and thinking about, you know, what does that mean? Does that mean like food deserts? Does that mean, you know, having access? Does it mean my funds ability? Like, just try to explain some of these things here when you look at these bullet points. But I'm going to keep going, because what I want to do is get into a little bit more of looking at more than just the effects. I've bolded some of the things that I think are important. Remember, this is a lecturette, so I'm not going to necessarily be going into this, but I want to spend a little bit more time on the intervention perspective as to, okay, so I have somebody here in my practice, they are overweight, and now I need to help them. So I went through the assessment, I figured that out, I know how to do that. Now, what is going to be my intervention, and how do I keep that up? So that's one of the things that I want you to start thinking about, is how do we help these people, and how do we help them? They're probably going to come in and they're going to want to lose. Most of my clients, when they come in, they want to lose 20 to 40 pounds. And of course they want to do it in 2 weeks. Now that's not realistic, but what can be realistic for them, and how are we going to do that? And can we set smaller goals so that they achieve their goals, so that they feel like they're doing more? You know, how are some of the things that we're going to handle that? So we're going to look into that a little bit, but 3 to 5% of your body weight can actually reduce or prevent a lot of different health diseases. So when I look at somebody's weight, I'm going to look at how much they're overweight, and then I'm going to try to just work on 3 to 5% of that. And if I can get that down, then I have a better chance of, you know, decreasing or keeping disease at bay for that. So we'll talk a little bit more about how do you do that in a minute. So what are some of the strategies for weight loss? So one of the things is, first of all, if you have people that are trying to lose weight, there's going to be times where they might be more successful than others. So sometimes just preventing weight gain can be a win. So keep that in mind, that even if you have a patient and you prescribe and you give them a diet plan that you think will be functional for them, and then it doesn't actually come, they come back and they haven't lost anything. Well, if they haven't gained anything, that's a win too. So keep in mind that that's always a good thing, that we are trying to keep preventing further gain, okay? And then we want to try to reduce body weight. We want to maintain a lower body weight over a longer period of time. There's going to be a lot of research out there that you guys come across that pretty much looks at behavior change doesn't do everything. And as much as a dietetic professional, I want to say that it can, it's not always feasible. There's probably going to be other interventions, which is what this lecturette really wants to delve into a little bit more, besides just, you know, the stuff we know as far as, you know, the proper nutrition and diet and exercise, and what are the other options, and how can I use them with my tool bag of what I have to make it work. Okay, so we've talked about cognitive behavioral therapy before. We watched that video in class, if you guys remember, and we were watching that TED Talk about that, and we talked a little bit about, social learning theory, and then we also talked a little bit about stages of change. And so how do we incorporate that in our nutrition counseling to, meet the client where they're at? So we're definitely going to use that with weight management, but we're going to use different tools. Like it could be stages of change. It could be social cognitive behavior change. It just could be different types of behavioral change that we might need to invoke in our clients. And so it's important for us to kind of help them through that. I recognize, and it says replace automatic and irrational thoughts and benefits. A lot of times when you talk to people, they'll say, I'm an emotional eater. I eat when I'm stressed. Well, so that's then this part of, how do we restructure their environment so that they can be successful? So part of what we do is going to be looking at that in addition to this numbers of calories in and calories out, and how do I work on that? So here is probably, to me, one of the most important parts is when we look at this and we look at the components of weight management, what do we do with cognitive behavioral therapy? So the first thing is that we have to set realistic goals. So even though they might have a goal of 40 pounds, 40 pounds can be very overwhelming to somebody. And so it's better if we look at it and take it in blocks. So, maybe we don't look, yes, the overall goal is 40 pounds, but let's focus on in the next 2 months, what do you want to get accomplished in 2 months? And what would be realistic? So 2 months, 40 pounds is not realistic. That is not going to happen in a healthy way. Okay, it could happen. It just may not be healthy. So how do we get them to see their realistic goals? Like working on that, rationalizing it. There's probably going to be a calorie deficit involved in this. That component has to be there physiologically. It has to be there. There's going to be other things, but that's definitely going to be one of the things that we want to look at. So we're going to provide them with a meal plan, right? Yes, we're going to figure out their calorie needs, and then we're going to how to get the foods that they want into that. And then we're also going to look at how can I help their skill development? How can I teach them to have the skills that they need when they're not with me or having this conversation with me, because I can't be in their house all of the time. So it kind of goes to this next one, which is the problem solving techniques. When they have problems, how do they deal with them? If they're a stressful eater, when they have a lot of stress, is there anything that they can do to decrease the stress in their life? And then last is self-monitoring and management. So that might include you, and it might include them coming back multiple times. However, some people might not be able to come back, especially if you're private pay and they're having to pay out of their pocket. So how can you help them with their self-monitoring? What other things are available? Are there apps they can use? Are there things like that? So, just kind of be thinking about some of those things here. Now, this is really talking about the components of a weight management program based on cognitive behavioral change. So these are the things we're doing, and I had mentioned it before, cognitive restructuring. How do I make their environment better for them? How do I help them with their stress management? Do they have a support system? When they do get stressed, what do they do? Who do they turn to? Who can help them besides you? What are some things? Are they getting exercise? Are they working out? Are they able to stay in this maintenance mode? Remember when we talked about stages of change? And how long you have to be in maintenance before we consider it maintenance. Remember that 3-month kind of rule? So thinking of that, and then thinking of the long-term effectiveness of this program. Like, is this something that they can sustain long-term? Can they keep coming? Can they commit to it? That kind of thing. Now, all that being said, there's a video here that you can play when you are watching. It's about 5 minutes long, and it's a story, and I usually only show, I show most of the video, but I show it because one of the things that when I worked with the American Indian population that one of my elders actually told me, and one of the things that this elder told me was, they said, Erica, if you want to make effective change for these folks, you have to make it meaningful to them. And so, and that's the same thing when we talked about, we watched that TED Talk. She said the same thing. It has to be meaningful. What is meaningful? Like when they see it versus, doing it. Like remember the basketball and the hole the size of your house, the size of a basketball, but when we just told them how many cracks they had, they weren't listening. That was what was meaningful. So this was a video that I put together for our clients to help them with it being meaningful and grabbing their attention. So keeping that in mind when you watch it, this is for the American Indian community. And if those of you that haven't worked with the American Indian community, one of the things that's very sacred to them is eagles. For those of you that don't know, Americans can't possess eagle feathers, but American Indian folks can't. So when you look at the eagle, it is a very sacred thing to the American Indian population. And so this is a story about an eagle. And it's a story that helps get them through and gets their attention so that they want to watch this. And then you learn a little bit more about the eagle going through this. And so I want you to watch it. And then when you, so you probably want to pause this, and then you want to go in, you want to watch that, and then you want to come back to this because I'm going to move on from this particular area. But to make it meaningful and to have this whole idea of how to help them from a holistic approach is what's going to work best from a weight management perspective. And this was just a video we used to let them know that we were there to help them. Okay, now, physical activity. I do want you to know this specifically for the exam. How much physical activity are we supposed to get when we are adults? So right here, I've bolded it, a minimum of 150 minutes. So that means 30 minutes, 5 days a week. So does it have to be all at the same time? No, it does. I think the same day would be great though, right? So, but 150 in a week, we'll take that too. But if you could break it down 30 minutes, and then does it have to be 30 minutes at a time? If you have someone who's sedentary, to ask them to do 30 minutes of activity is probably not realistic. Remember the realistic goals? Maybe what is realistic for them though? Maybe that realistic is, you know, I can do 10 minutes in the morning. I can do a 15-minute walk after I eat lunch. And then maybe I can do a 10-minute walk again when I'm at home, or if they have a treadmill or something like that. So, you know, keep in mind, how do you get them to meet that? See what give and take where you can get. But your overall goal and what you're trying to improve on is 150 minutes. Okay, now, this is what I also want you to know, is that when we are starting to help people with weight loss and they are becoming successful and they are making behavioral changes, that you want them to be continuing to feel good and to have goals and to make their goals and set their goals. If they have set goals and then they don't meet them, are they likely to do it again? No, it's like you. If you study for an exam and you study really, really hard, and then you take the exam and you did poorly, do you really want to study hard for the next one? I mean, maybe because you need to get your grade higher, but other than that, you don't really want to do that. Like, you're defeated and you feel defeated. So it's the same thing in this weight loss journey with them. Like, how do we do this to make it more effective for them? So one of the things I want you to know that's going to happen anyway, no matter what, even if they are hitting their goals and going forward, is that after 6 months of weight loss, that usually is going to decline and it's going to hit what we call a plateau. That is just this area where they just, you know, nothing is helping them. So I want you to think about that, because we're going to move into this next area about when diet and exercise are not the only lines of defense. What can you do? Well, sometimes one of the things that I would use in my practice, or what I think is beneficial, is there a time in which we can utilize some of these other supplemental therapies out there to when they're at that plateau and they're not doing anything more? Is there something I could do to help them a little bit more with that? So keep that in mind. So there's usually the reason for this physiologically is that there's a metabolic compensation, or this energy gap that we talk about, that the body's, again, trying to get to the set point and trying to conserve and trying to do all of these things. So there's a misconception that most people regain all lost weight. But what we do know is the people that we follow that are successful, they do have certain things that they do as far as their behaviors. And one of the things that they actually do is they record what they're eating. They do a food journal. And they do it at least 3 times a week. So that is something that I can tell you, that the data is out there, that it is successful, but the people that are successful are the ones that are tracking it, because it's almost like your checking account. You know, if you're keeping up with it and you know what you have in your money or your bank, then you're doing very good. But, you know, if you forget to check your bank account, you just got paid and you go on a spending spree, and then you go to check your bank account and you're like, oh, I don't have any money. You know, it's that same concept here. So, and then again, more success with these behavioral strategies. So consistently controlling the calorie intake is really kind of good for them, and understanding and watching and helping them get to that place where they can find and they can do it on their own. Like, you're going to help them, you're going to do the number, but then they're going to be the ones that want to kind of pick up their plan. You might start with the plan, but then you need to get them to do their own plan to make it. They probably, when they do that, are not going to have too much fast food in there, but can you eat fast food while you're doing this? Absolutely. You just have to pick your choices, and that's where we have to educate them on what those choices are. They want to eat all foods, but limit the quantities. So that's the other thing that dietitians really strive on, right? Is that we say all foods fit, and they do. But it's about the quantities and how often and how much, right? Exercise more often and as strenuously as possible. Remember that breath test. If you're going at it and you're kind of short of breath while you're doing it, that's good. If you're and can't breathe, then that's not good either. So we got to get them to that point where they can get to a point that's working for them and is not too strenuous, but is strenuous enough that it's still keeping them at a level in which they can burn the calories in which their body needs. They're going to probably need to track their weight. How often does one do that? When do they do it? Those are the questions they're going to ask you. So keep in mind that one of the things that we want to have them do is probably want to have them weigh about once a week. If they're weighing every day, it becomes obsessive, and there's fluctuations in your weight just based off of your water and the fact that 70 to 80% of your body's water. So if they do it every day, it can change just based off of how it was. And if they worked out and then they didn't drink and then the body wants more water and so they drank the next day and it holds on to the water, then they might be retaining water. So there's lots of different reasons. But so we usually say once a week, and we usually say to do it at the same time every week. So it doesn't matter, is it morning, is it night, does it really matter? Not really, as long as they're doing it consistently. They just don't want to do one time where one week they weigh in the morning and then the next week they do it again in a week, but then they did it in the evening. That's different because again, fluid takes different times, okay? And then we definitely know that the eating breakfast, we've said this before, because it's breaking a fast and how important that is. So, get them to make sure that they're trying to get that breakfast in. Okay, now the pharmacotherapy for weight loss. This is the major component of this particular lecturette for you guys that I want to get at, is that when we look at therapy for weight loss, that there are some things that we need to think about, because we need to get weight off of people. And sometimes just diet and exercise aren't enough or not fast enough. I can also tell you, I had a doctor one time tell me that they needed to put a patient on a ketogenic diet, or like an Atkins-based type of diet, because the gentleman had prostate cancer and they needed to operate on his prostate, but he was too large to fit on the table, the operating table that they used to do the prostate procedure. So he had to get him down really fast. Then in that case, we needed to be very fast. We worked the ketogenic diet on them, but maybe we did something with pharmacological background as well. So let's look at medication. So is it always, yes, we're a pill popping society and food first, supplement second? Well, sometimes we have to supplement with weight loss drugs. And so let's take a look at some of those. It's important for us to be aware. It's important for us to also know what people are taking, because there's a lot out there. There's a lot of herbal ones that are out there right now. I love it, but I hate it. Like when I drive and I see all the Metabolite and all these different companies that are out there, selling products to people that are not approved by the FDA. So, let's look at this and let's see what's out there and what's going on. Okay, so what can we look at here about weight loss? So when we are looking at following up, regardless if we start the pharmacodynamics, which I'm going to get into in a minute, that we want to have an ongoing process with them. It's important for them to have some kind of coach. Usually the dietitian is that coach, but keep in mind there's a lot of lifestyle coaches out there now. So we want to make sure that they're getting ones that are qualified. Okay, and then be familiar with all the smart apps and wearable devices. I love my iWatch because it tells me when to stand up. It tells me, it challenges me to meet my goals and to get more goals and set more goals. So keep in mind, all of those things are going to set you up well. Now, here we go. Pharmacotherapy for weight loss. So when we look at this, what do we need to know? Okay, so I have set up for you inside the Canvas some videos that I want you to watch. So you're going to go ahead and watch these videos on these different drugs, because these drugs are the newer drugs that are on the market that we're using to treat obesity. And what I want you to be thinking about is, how do these drugs, when could I use these drugs? And are some of them different? There's strengths and weaknesses in all of them. And I want you to start looking at them when you watch the video, because I want you to find out, like, is this good for this population, or when this one might be better for this population? Just as a guideline to kind of look at these to see, and then also to think about, from the perspective of, what if someone takes it, they're not taking it as it's prescribed, and then they say, oh, this drug doesn't work, and then they tell friends, and they tell other friends, and they tell other friends, and then the drugs get a really bad rap. So it's important for us to know what they do, what mechanisms they're using, and who they're actually going to be beneficial for. So go ahead and watch all those videos that I have for you there. And then I have a discussion question about them in our discussion area inside the module as well. The other part that I have a discussion area for and want to give you more information about is the actual bariatric surgery, because there's quite a few. There's a big area right now for dietitians to work in bariatric surgery. And one thing that I can tell you is that when we started, we, as dietitians, when I started, we didn't have bariatric surgery. It started, and then we started to see it kind of ramp up. And at first I was like, yeah, I don't think this is a good idea because, you know, they cut out their stomach and their stomach is the size of an egg or a golf ball when it's supposed to be the size of their fist. How are they going to meet all of their nutrient needs? So I want you guys to be aware of what are some of the needs that they are going to have if they have the gastric bypass. And then, is the gastric bypass for everybody? Is there going to be times when this is more beneficial? Is there going to be times where it's less beneficial? So I want you to look at the procedure itself, and then we kind of want to explore, who is this really good for? Now, guidelines are going to say this. This is what the slide is talking about. And if I was asking you quiz questions, this is what it might be looking for, is that we tend to not do bariatric surgery until we have patients that have a BMI at 40 or above, or they can be 35, but they have to be high risk, meaning that they have some other chronic disease, okay? So they're going to have something else going on, hypertension, diabetes, something like that, that's most likely going to happen. Because what happens with the gastric bypass is that they need to be motivated to change afterwards. So we're trying to, a lot of times dietitians, in order to get a gastric bypass for Medi-Cal, per se, that you actually have to see a dietitian, and you actually have to see a dietitian a couple times so that we can provide that recommendation. They also have to see a psychosocial therapist as well, who's also going to make that determination on if this is something that we think that they're going to be able to do for these aftercare guidelines. Because as you can see, sometimes that may not always be the case where it's not for everybody, especially if they're using food as a coping mechanism. And if we take that coping mechanism away from us, what is going to happen? One of the things that we have had to look at is that the rate of people that have had a gastric bypass then have also higher rates of what other things happening to them. And usually one of those ones is we have increased alcoholism, we have increased substance abuse, and then we also have, I've seen some where we actually have suicide. And we also have like obsessive compulsive disorders, like obsessive shopping, and sometimes even just like obsessive like disorders with like sexual things, because they have no other coping mechanisms, so they're moving on to the next one. So this is something that we need to think about, and something that you might want to explore out there in addition to this lecture, and in addition to looking at what we have for the gastric bypass. And then specifically, what are going to be the micronutrients that are going to be deficient? The macronutrients are a little easier to get in. It's the micronutrient deficiencies that are harder. The macronutrients will come and can be okay, but usually we find that we have to supplement. So I want you to be aware as to what are going to be some of the large macro and micronutrients that are going to be harder. So the macros are pretty much obvious one that's probably going to be protein. And then when we look at the micros, I want you to look it up. The textbook talks about it. So, you know, delve in there a little bit, and then understand, you know, what they're going to have to do to maintain that. And then overall, just to kind of sum it up, so what are some of the ways that we can help treat obesity? That's what I want you to really take away from this, is that we can look at diet. And within diet, there's all these different parameters, right? There's the behavior modification, there's the calorie setting, there's programs, there's support, you know, looking at all of that. But then we also want to talk about exercise and how exercise can help that. And then also, maybe if that's not enough, are there other options out here? Are we looking at medications? Are there over-the-counter that you would recommend? Are there prescriptions that you might recommend? And then if those don't work, is there an option for weight loss surgery? So just to kind of bring you through in summary of the areas that we want to look at when we're trying to help them, these are going to be kind of the big areas that we want to hit to make sure and find out where our client is and how we can help them in this process. So I hope this little lecturette was helpful, and I will be doing some more of these for the other set diseases in this particular conditions and intervention section of chapter 17. So I will see you guys later.